is the wheeze. A wheeze is a high-pitched noise that can be heard on both inspiratory and expiratory breaths. If the wheeze is heard on the inspiratory portion of the breath, it often indicates an obstruction in the upper portions of the airways. However, if you hear the expiratory wheeze on the lower portions, it can indicate that there's a lower airway obstruction. This is commonly heard in asthmatics or bronchiolitics. It is a very important note to say that if you've heard wheeze on your initial respiratory exam and that wheeze disappears, be sure that the patient has not lost their ability to aerate at all. Sometimes we're reassured by the absence of the wheeze, but in fact that may indicate that those airways have closed so much there is now no air movement at all through them. Coarse breath sounds are the noises you'll hear when the patient has secretions or fluid buildup in the lungs. This generally indicates that the patient needs to cough, or if they have an endotracheal tube, you may need to suction them. Crackles or rails are often heard in the lower portions of the lungs. This typically indicates that there is extra fluid or friction taking place in the lower portions of the lungs and is usually associated with pneumonia or pleural effusion. These sounds can all be heard on both inspiration and expiration, though may be more audible in the expiratory phase. The next thing we want to do is feel the patient. When the patient talks, you can feel something like tactile fremitus. If you place your hands on the patient's lungs and they speak, you should actually hear the vibration. These should be equal on both sides. Crepitus is something very specific and will happen if air develops under the subcutaneous tissue in the child's chest wall. You can palpate around and will often feel tiny air bubbles along their chest. This is also incredibly concerning as it can mean there is an air leak somewhere under the patient's skin.